That shooting pain that starts in your lower back and fires down through your buttock, your thigh, your calf, sometimes all the way to your foot. That burning electric sensation that makes sitting unbearable, standing exhausting, and sleeping almost impossible. If you know that pain, you know sciatica. And if you have been dealing with it for months or years, you probably also know the frustration. Painkillers that wear off. Physical therapy that helps in the clinic but does not hold. Injections that work for a few weeks and then the pain comes back. Surgery recommended. A life organized around managing pain that never fully goes away. But I want to ask you something before we go any further. Have you ever wondered why some people with sciatica get better with simple treatment, while others with the exact same diagnosis spend years in debilitating pain that nothing seems to fully resolve? Same nerve, same compression on the MRI, completely different pain experience. I have asked that question throughout my career, and the answer, which the research increasingly supports, has a great deal to do with what those two groups of people are eating, specifically what they are or are not giving their sciatic nerve every single day. The sciatic nerve is a living structure that requires specific nutrients to maintain its myelin sheath, regulate its pain threshold, and resist the oxidative damage that chronic inflammation causes to nerve tissue. When those nutrients are consistently present, the nerve tolerates compression better, sensitizes less easily, and recovers faster. When they are chronically absent, the nerve becomes hyperreactive, firing pain signals at stimuli that a well-nourished nerve would barely register. One nut, eaten every morning, provides the exact array of nutrients that the sciatic nerve specifically needs: omega-3 fatty acids, vitamin E, magnesium, and polyphenols to reduce its inflammatory load, protect its myelin, and lower its pain threshold back toward normal. My name is Dr. Michael Kent. I have spent over 20 years in medicine focused on senior health, and today I'm going to tell you exactly what that nut is, what each of its compounds does to your sciatic nerve at a biological level, and how to use it as part of a complete sciatica approach that most specialists never mention. By the end of this video, you will understand your sciatica in a way you never have before, and you will have a tool you can start using tomorrow morning. Stay with me. Before we go any further, if you are not yet subscribed to this channel, please hit that subscribe button and tap the bell icon right now. I post new senior health videos every single week, the kind of honest, research-based information that can genuinely make a difference in your daily life. You do not want to miss what is coming. Subscribe now, then let us get into everything about sciatica and this remarkable nut. Let me start with what sciatica actually is at a biological level, because I think most people who have been given this diagnosis have never had it properly explained to them, and understanding it is the foundation for understanding why what I am about to share actually works. The sciatic nerve originates from 5 nerve roots in your lower spine at the L4, L5, S1, S2, and S3 levels. These roots merge in the pelvis to form the sciatic nerve, which then travels through the buttock, down the back of the thigh, splits above the knee into the tibial and peroneal nerves, and continues all the way to the feet. It is the longest and widest single nerve in the human body, and it carries both sensory signals from your leg to your brain and motor commands from your brain to your leg muscles. Sciatica occurs when this nerve, or one of the nerve roots that feeds into it, becomes compressed, irritated, or inflamed. The most common cause is a herniated disc in the lower lumbar spine, where the soft inner material of an intervertebral disc bulges out through a tear in the outer casing and presses on an adjacent nerve root. Other causes include spinal stenosis, narrowing of the spinal canal, and piriformis syndrome, where the piriformis muscle in the buttock compresses the sciatic nerve as it passes nearby. But, and this is the critical point that most explanations of sciatica miss entirely, the structural compression is only part of the story. The degree of pain a person experiences is not determined solely by how much compression is present. It is determined by the inflammatory environment surrounding the nerve at the point of compression. When a disc herniates, it does not just mechanically press on a nerve root. It also releases a cascade of inflammatory chemicals, including phospholipase A2, tumor necrosis factor alpha, interleukins, and prostaglandins, directly onto the nerve tissue. These chemicals lower the nerve's firing threshold, causing it to generate pain signals with far less mechanical stimulation than it normally would. They also cause the nerve itself to become swollen and edematous, physically enlarged, which worsens the compression even when the original herniation is modest in size. This inflammatory component is why two people can have identical herniation sizes on MRI and have vastly different pain experiences. One person's immune system produces a more contained inflammatory response. The other's produces a more aggressive one. And the difference in pain between them has almost nothing to do with the disc. It has everything to do with inflammation, which brings us directly to the nut. The nut is walnuts. And before I explain the specific mechanisms, I want to address the obvious question: Why walnuts specifically when there are so many nuts available? The answer is in their unique nutritional profile. Walnuts are the only tree nut with a significant content of alpha-linolenic acid, LA, the plant-based omega-3 fatty acid that the body converts to EPA and DHA. They contain more polyphenols than any other tree nut, specifically L-argitannins that are converted by gut bacteria into urolithins with direct anti-inflammatory effects in nerve tissue. They are a meaningful source of both magnesium and vitamin E, specifically gamma-tocopherol. And they contain melatonin in concentrations higher than almost any other whole food, which has direct nerve protective effects that most people are completely unaware of. No other single nut combines all 5 of these properties, and for sciatica specifically, all 5 work together in ways that individually they cannot match. Let me walk you through each mechanism. The first mechanism is omega-3 fatty acid competition with inflammatory prostaglandins. EPA and DHA, produced from walnut ALA, directly compete with arachidonic acid for the cyclooxygenase enzyme. This is the same enzyme that ibuprofen and naproxen block when they reduce pain and inflammation. When EPA and DHA occupy COX, fewer inflammatory prostaglandins are produced at the nerve root. The nerve's firing threshold rises. It takes more stimulation to produce the same pain signal, and the burning shooting quality of sciatic pain, which is driven largely by prostaglandin-mediated nerve sensitization, begins to ease. A meta-analysis published in the journal Pain Medicine reviewed 8 clinical trials on omega-3 supplementation for neuropathic pain and found consistent, significant reductions in pain scores across studies. The effect was most pronounced for burning and shooting pain qualities, precisely the qualities that characterize sciatic nerve pain, and was seen with as little as 2 grams of combined EPA and DHA daily, which is achievable through consistent walnut consumption combined with 1 to 2 servings of fatty fish per week. The second mechanism is urolithin inhibition of NF-κB in nerve tissue. When walnut L-argitannins are metabolized by gut bacteria into urolithins, these compounds have been shown in research published in the European Journal of Nutrition to directly inhibit NF-κB, the master inflammatory switch that controls the production of tumor necrosis factor alpha and interleukin-6. These are 2 of the primary inflammatory cytokines released when a disc herniates onto a nerve root. When NF-κB is inhibited in the tissue surrounding the compressed nerve root, the entire inflammatory cascade that amplifies sciatic pain is dialed down. The third mechanism is magnesium's role at NMDA receptors in sciatic nerve pain pathways. As I discussed in my back pain video, magnesium sits in NMDA receptors on nerve cells and blocks excessive calcium influx that causes central sensitization, the process where the nervous system amplifies pain signals beyond what the actual tissue damage warrants. For sciatica specifically, central sensitization is a major contributor to chronic sciatic pain that persists even after the original compression has reduced or resolved. The shooting electric quality of sciatica, and particularly the allodynia where even light touch on the leg produces pain, is a classic sign of central sensitization. Adequate magnesium from regular walnut consumption directly counteracts this sensitization by maintaining NMDA receptor blockade. The fourth mechanism is gamma-tocopherol protection of sciatic nerve myelin. Myelin, the fatty sheath surrounding nerve fibers, is highly vulnerable to oxidative damage from the reactive oxygen species produced in chronically inflamed tissue. When the myelin around the sciatic nerve degrades, nerve signal transmission becomes erratic, producing the tingling, numbness, and shooting pain that characterizes advanced sciatica. Gamma-tocopherol, the specific form of vitamin E in walnuts, is a potent lipid-soluble antioxidant that specifically protects myelin from this oxidative degradation. It quenches the free radicals produced in inflamed nerve tissue before they can damage the myelin membrane, preserving nerve signal integrity and reducing the hypersensitivity that comes from myelin damage. The fifth mechanism is melatonin's direct nerve protective and anti-nociceptive effects. This is the one that most people and most doctors have never heard. Walnuts contain melatonin in bioavailable form, and melatonin, beyond its well-known sleep-regulating function, has direct pain-modulating effects at the spinal cord level. It acts on melatonin receptors in the dorsal horn of the spinal cord, the region where pain signals from the sciatic nerve are first processed, and reduces the excitability of pain-transmitting neurons there. Research published in the Journal of Pineal Research has shown that melatonin administration reduces neuropathic pain scores in animal models of sciatic nerve injury, and clinical studies in humans have found significant pain reduction in patients with chronic neuropathic conditions following melatonin supplementation. Consuming walnuts in the morning, when the melatonin they contain is delivered to the gut during the digestive absorption peak, provides a direct source of this nerve protective compound to the tissues processing sciatic pain signals. Now I want to tell you about a patient of mine named Sandra. Sandra was 64 years old when she came to see me, 18 months into what she described as the worst physical experience of her life. Her sciatica had begun after a minor back strain and had never resolved. She had a small disc herniation at L5S1 that her spine surgeon described as modest in size. Her pain, however, was severe, burning, shooting, present every single day, waking her at 3 in the morning, preventing her from sitting for more than 20 minutes, preventing her from walking more than half a block. She had been through 2 courses of physical therapy, 1 epidural steroid injection, and was on daily gabapentin, a nerve pain medication, with only partial relief. Her surgeon was discussing surgery. Sandra was terrified of surgery and came to me asking whether there was anything else to try. When I reviewed her diet, the first thing I noticed was that Sandra ate almost no fatty fish, very few nuts, and had a diet that was high in refined carbohydrates and low in anti-inflammatory whole foods. Her inflammatory markers, CRP and interleukin-6, were significantly elevated. Her RBC magnesium was low. She was nutritionally providing her inflamed sciatic nerve with almost none of the compounds it needed to reduce its own sensitization. I recommended a complete dietary shift toward anti-inflammatory foods, and specifically 1 ounce of raw walnuts every morning with breakfast as the cornerstone of that shift. I also recommended omega-3 supplementation to accelerate the process and transdermal magnesium oil applied to her lower back and buttock daily. At her 6-week follow-up, Sandra told me her pain was still present but had shifted. The burning quality had reduced noticeably. She was sleeping better. The 3 a.m. wake-ups were less frequent. At 12 weeks, she described her pain as reduced by approximately 40% from baseline. At 6 months, she had tapered off gabapentin with her prescribing doctor's guidance. She had not had surgery. Sandra's disc herniation is still there. That structural finding has not changed, but the inflammatory environment surrounding it has changed dramatically, and the pain, which was primarily driven by that inflammatory environment amplifying a modest compression into a catastrophic pain experience, has responded accordingly. Let me now give you the complete practical protocol. 1 ounce of raw walnuts, approximately 7 whole walnuts or 14 halves, every single morning with or shortly after breakfast. Raw or dry roasted only. Never oil roasted, which oxidizes the omega-3 content and converts it into pro-inflammatory compounds. Store in an airtight container in the refrigerator to prevent oxidation. Fresh walnuts should taste mild and slightly buttery. If they taste sharp or chemical, they have oxidized and should be replaced. Give this protocol a genuine 3 months before assessing its impact on your sciatica. The anti-inflammatory effects of consistent omega-3 intake accumulate over weeks. You will not feel a meaningful difference after 1 week. 4 to 6 weeks is when most of my patients begin to notice a shift in the quality or intensity of their pain. 3 months is where the full effect becomes apparent. Alongside the walnuts, 3 additional strategies directly support sciatic nerve recovery. The first is cold and heat alternation applied to the lower back and buttock. Cold reduces acute inflammatory swelling around the nerve root. Heat increases blood flow and relaxes the surrounding muscles. Alternating between the two, 10 minutes cold, 10 minutes heat, twice daily, addresses both the inflammatory and muscular components of sciatica simultaneously. The second is the piriformis stretch. The piriformis muscle, when tight, can compress the sciatic nerve as it passes through the buttock, a condition called piriformis syndrome that is often mistaken for disc-related sciatica. A gentle piriformis stretch, lying on your back, crossing the affected leg over the opposite knee, and gently pulling both knees toward your chest, held for 30 seconds 3 times daily, directly relieves this compression and is one of the most effective things you can do for sciatica pain at home. The third is walking, specifically short, gentle walks of 10 to 15 minutes, 2 to 3 times per day. Movement keeps the sciatic nerve mobile, prevents adhesions from forming around it as the inflammation heals, and activates the body's natural endorphin production that reduces pain perception centrally. Do not rest completely with sciatica. Gentle, consistent movement is one of the most evidence-based interventions available. Let me bring everything together. Sciatica pain is driven not just by structural compression, but by the inflammatory environment surrounding the compressed nerve, prostaglandins, cytokines, and oxidative stress that sensitize the nerve and amplify pain far beyond what the compression alone would produce. Walnuts address this inflammatory environment through 5 simultaneous mechanisms: omega-3 prostaglandin competition, urolithin NF-κB inhibition, magnesium NMDA receptor stabilization, gamma tocopherol myelin protection, and melatonin spinal cord pain modulation. 1 ounce every morning, raw or dry roasted, refrigerated for a minimum of 3 months, combined with cold heat alternation, piriformis stretching, and gentle daily walking. Sandra avoided surgery, not because surgery is never appropriate for sciatica, sometimes it is absolutely necessary, but because her pain was primarily an inflammatory problem that was being inadequately addressed. Give the sciatic nerve the nutrients it needs to reduce its own sensitization, and the body's capacity to heal, even around a persistent structural compression, can be genuinely remarkable. If this video gave you something valuable today, please do 3 things. First, give this video a thumbs up. It takes 1 second and helps this information reach more seniors who are suffering with sciatica and have never been told any of this. Second, leave a comment below and tell me, how long have you been dealing with sciatica? And have you ever tried walnuts consistently? I personally read every comment on this channel and reply to as many as I can. And third, share this video with someone you know who is living with sciatica.